अस्सलाम वालेकुम दोस्तों। एक बार फिर से खुश आमदीद है हमारे चैनल पर आप सबका। और उम्मीद करता हूँ कि आपको हमारी जो प्रीवियस वीडियोस हैं वो काफ़ी इन्फॉर्मेटिव साबित हो रही होंगी। और इंशाल्लाह इन फ्यूचर भी आपके लिए हम इस तरह की इन्फॉर्मेटिव वीडियोस लाते रहेंगे। और इसी तरह आपके लिए हम मेहनत कर कर वीडियोस ढूंढते रहेंगे। और लिहाजा उम्मीद करते हैं कि आपको आज का जो एक्सक्यूज़ मी, उम्मीद करते हैं कि आपको आज का ये जो हम टॉपिक लेकर आए हैं ये भी उतना ही पसंद आ गया जिस तरह आपने प्रीवियस वीडियोस में हमारे जो टॉपिक्स हैं उन्हें पसंद किया। और इसी तरह हम आपके लिए एक और अमेजिंग टॉपिक लेकर आए हैं। चैनल को सब्सक्राइब कर लें, बेल आइकन पर क्लिक कर लें और वीडियो को ज़्यादा से ज़्यादा शेयर और लाइक ज़रूर कीजिएगा। और कमेंट कर कर बताइएगा, अपनी राय का इजहार ज़रूर कीजिएगा। सो हाउ यूएस हेल्थ इंश्योरेंस वर्क्स। आज हम बात करेंगे कि यूनाइटेड स्टेट्स में हेल्थ इंश्योरेंस आखिर किस तरह वर्क करती है। सो एज यू कैन सी ओवर हेयर, हेल्थ केयर इन द यूनाइटेड स्टेट्स कैन बी वेरी एक्सपेंसिव। सो सबसे पहला पॉइंट ही उन्होंने हाईलाइट यहाँ पर ये किया है कि हेल्थ केयर है यूनाइटेड स्टेट्स के अंदर काफ़ी एक्सपेंसिव हो सकती है। So, a single doctor's office visit may cost several $100s, and an average 3-day hospital stay can run tens of thousands of dollars or even more. Depending on the type of care provided, most of us could not afford to pay such large sums if we get sick, especially since we don't know when we might become ill or injured or how much care we might need. Health insurance offers a way to reduce such costs to more reasonable amounts. The way it typically works is that the consumer you pays an upfront premium to a health insurance companies, and that payments allows you to share risk with lots of other people enrollees who are making similar payments. Since most people are healthy most of the time, the premium dollars paid to the insurance company can be used to cover the expenses of the relatively small number of enrollees who get sick or injured. Insurance companies, as you can imagine, have studied risk extensively, and their goal is to collect enough premium to cover medical costs of the enrollees. There are many different types of health insurance plans in the US, and many different rules and arrangements regarding care. So अगर इन सारी चीज़ों को following are the three important questions you should ask when making a decision about the health insurance that will work best for you. ये आपके लिए थ्री इम्पोर्टेंट क्वेश्चन लेकर आए गए हैं जिनसे आपको अच्छी तरह अंदाज़ा हो सकता है कि आपको क्या क्या प्लान के अंदर आप उस चीज़ को कवर कर सकते हैं। जैसे कि वेयर कैन आई रिसीव केयर। वन वे दैट हेल्थ insurance plans control their cost to influence access to providers. Providers include physicians, hospitals, laboratories, pharmacies, and other entities. Many insurance companies contract with a specified network of providers that has agreed to supply services to plan enrollees at a more favorable pricing. If a provider is not in plan's network, the insurance company may not pay for the service provided or may pay a smaller portion that it would for in network care. This means the enrollee who goes outside of the network for care may be required to pay a much higher share of cost. This is an important concept to understand, especially if you are not originally from the local Stanford area. If you have a plan through a parent, for example, and that plan network in your hometown, you may not be able to get the care you need in the Stanford area, or you may incur much higher cost to get that care. So, what does the plan cover? One of the things healthcare reform has done in the US under the Affordable Care Act is to introduce more standardization to insurance plan benefits. Before such standardization, the benefits offered varied drastically from plan to plan. For example, some plans covered prescriptions, others did not. Now, plans in the US are required to offer a number of essential health benefits, which include emergency services, hospitalizations, laboratory tests, maternity and newborn care, mental health and substance abuse treatment. Outpatient care doctors and the other services you receive outside of a hospital. Pediatric services include dental and vision care, prescription drugs, preventive services, for example, some immunizations and management of chronic diseases, rehabilitation services for our international population of students who might be considering coverage through a non-US based plan. Asking the question, what does the plan cover, is extremely important. And the third and the last question is key question. How much will it cost? So this is the most important question that everybody wants to know. Understanding what insurance coverage cost is actually quite complicated. In our overview, we talked about paying a premium to enroll in a plan. This is an upfront cost that is transparent to you. You know how much you pay. Unfortunately, for most plans, this is not only the cost associated with the care you receive. There is also typically cost when you access care. Such cost is captured as deductibles and coinsurance and or co-pays. See definitions below and represents the share you pay out of your own pocket when you receive care. As a general rule of thumb, the more you pay in a premium upfront, the less you will pay when you access care. The less you pay in a premium, the more you will pay when you access care. The question for our students is pay a larger share now or pay a larger share later. Either way, you will pay the cost for your care you receive. When we have taken the approach that is better to pay a larger share in the upfront premium to minimize as much as possible costs that are incurred at the time of service. The reason for our thinking is that we don't want any barrier to care, such as a high copay at the time of service, to discourage students from getting care. We want students to access medical care whenever it's needed. सो उम्मीद करते हैं कि आपको ये जो तीन मेन की क्वेश्चंस हैं इनकी अच्छे से समझ आ गई होगी कि आखिर यूएस में हेल्थ जो आपकी इंश्योरेंस है वो किस तरह वर्क करती है, क्योंकि बाकी ये जो आपके की पॉइंट्स हैं आपको एनुअल डिडक्टेबल के बारे में, आउट ऑफ पॉकेट एक्सपेंसेस के बारे में, को इंश्योरेंस के बारे में, एनुअल आउट ऑफ पॉकेट मैक्सिमम के बारे में डिटेल से बताया गया है। तो इसके डिटेल में भी हम किसी दिन नेक्स्ट इंपॉर्टेंट इंश्योरेंस टर्म्स एंड कंसेप्ट के बारे में वीडियो बनाकर उसको डिस्कस करेंगे। तो उम्मीद करता हूँ कि आपको ये वीडियो पसंद आई होगी और हेल्थ बेनिफिट से रिलेटेड और इस तरह की और वीडियोस को देखने के लिए चैनल को सब्सक्राइब कर लें और अपनी राय का इजहार कमेंट में ज़रूर कीजिएगा। ज़्यादा से ज़्यादा वीडियो को शेयर कीजिए और मैं मिलता हूँ आपके साथ नेक्स्ट वीडियो में। तब तक के लिए हमें दीजिए इजाज़त। अल्लाह हाफ़िज़।